In Maldives, even traditionally, there has not been any differences in terms of policy or law that differentiates gender when it comes to job opportunities and remuneration, except that the circumstances that women find themselves in a traditional society related to upbringing of children and domestic roles that prevent women from taking advantage of the equal opportunity for employment. As our society has become more progressive, the circumstances for women to avail these opportunities have become more favorable. Historically, the health sector has seen and benefited from many great and inspirational women leaders in all its echelons, including the positions of minister, state ministers, deputy ministers, and director generals. In fact, with the introduction of permanent secretary position under the Maldives Civil Service, women have been filling this position at the Health Ministry. So at a personal level, when I chose my career at health sector, I already had great expectations for myself and for the health sector, and I could clearly see the opportunities for women to assume leadership roles in this sector. And then there are our predecessors and current leaders who continued to inspire people like myself. I am very happy to be where I am, and it's fulfilling personally and professionally. In my view, the question may be more aptly rephrased to say, what more can be done to improve, to give due recognition to the fact that women leaders are already at the forefront of fighting this pandemic? In fact, some of the countries that have done comparatively better than other countries have women as head of government or ministers of health. Certainly, a lot more can be done to improve and uplift their roles in this pandemic. If we really look at the various dimensions of the pandemic, be it the prevention and treatment responses or the socio-economic impacts of the disease, more women than men are involved in the response and are adversely affected socially and economically. This is especially true for the frontline workers, particularly nurses, who perform dual roles in the response phase and domestic or home fronts. Therefore, if there's one single thing that can improve women's leadership, it is to give them a stronger voice by involving them in decision making, as so many of these decisions affect the physical and mental health of the women of COVID-19. Perhaps it is more critical to engage women in the discussions and decisions that are going to shape the post-pandemic world. Women in health are certainly the glowing stars of COVID-19.